We have a very special episode for you guys today. It is an interview with a practitioner who I have had the great honor of meeting in Sedona at during one of the retreats that I co-host really, with my good friend Katrine Valinsky. Those of you who've been listening to this podcast for a while know that a couple of times a year I will invite people to join me in Sedona, where we do these very personalized medical type retreats where people can do personalized IVs. They can do all kinds of really cool practices like Ibu. We do hiking in Sedona in the mountains. We do yoga, and people get access to really next level body workers. And one of those body workers, and really physicians, is my guest today. His name is Dr. Tudor Marinescu. And Dr. Tudor originally is from Romania, but ended up studying, you'll learn about this in the episode. He ended up studying to be an orthopedic surgeon in Germany, then got into osteopathy, and his journey went on from there. So I can't wait for you to meet him and to learn about what he does and how transformative his therapies are. They certainly have been for me. But before we jump into the episode, always, I want to thank you guys. I'd love to send you to my website. I did a little more talking here than I usually do, so I don't want to keep you back too long, but please head over to the website, natnidham.com. Definitely sign up for the newsletter. If you're into peptides or curious about peptides, sign up for the peptide specific newsletter. I now have 2 different communities on the go. One is the big membership community where I personally do live Q&As and invite many of my podcast guests to do the same. Or we're hosting the Peptide Parlor, which is really just a conversation forum. It's private. It is not censored as it would be on the big platforms. And it's very inexpensive, but really I just charge the money so I can pay some admins to help us out in there. But it's a great, safe place where you can meet like-minded people and jam out on the things that are really interesting you these days in terms of moving the needle, whether it's peptides or other types of health practices. If you're feeling inspired when you're listening to this episode and you have a spare minute, please make sure to leave us a review on whatever platform you're listening to the episode on. And like I said, natnidham.com is where you'll learn about everything you need to know. My guest today is Dr. Tudor Marinescu, a former trauma and orthopedic surgeon who now helps people heal in ways that go way beyond stitches and scans. And he figured out he wanted to change his course pretty early in the game. We talk about his journey from the ER to the energetic, how he discovered the power of osteopathy, and why the body isn't just a machine, it's a memory bank. We dive into how emotions can get trapped in the body, what that has to do with your autonomic nervous system, and how techniques like neural therapy and Procaine injections can actually help reboot your system emotionally and physically. I personally have had the pleasure of working with Dr. Tudor on this old body, and I can tell you that his way of doing things is absolutely transformative. He is a key part of our Sedona retreats now, to the point where we align our schedules so that we make sure that he's available to our members, to the people coming out to the retreat when we're there. So, but you got to hear a story, you guys. He's really, really, really very special man and physician. So if you want to learn more about Dr. Tudor, you can go to his website. It's drtudor.com. That'll be in the show notes. And until then, until you check out his website, enjoy the interview. Like I said, he's a really special guy and a very, very talented physician. Hey folks, just a quick reminder that all of the information presented in this podcast is for information purposes only. No medical advice, no diagnosing, no treatments suggested here. Before you try anything that you hear about or learn about here, make sure that you check with your medical provider. Welcome to the show, Dr. Tudor Marinescu. It is such a pleasure to see you again, sir.
Thank you. Pleasure is mine.
Yeah, well, this is going to be fun. So, for those of you who skip through the entire intro, which I know a lot of people do, they just want to get to the show. Dr. Marinescu and I met last November on one of those crazy retreats that I do in Sedona with my good friend, Katrine Volinsky. And I was so blown away by Dr. Marinescu's just the little bit that I was able to learn from him while I was there, the treatments I experienced, the shifts I personally experienced in the treatment that I'm like, okay, we got to get this out there. We got to have a conversation. We got to share this. So, so Dr. Marinescu, some of you may know, is an osteopath, but I'm going to tell you right now, the osteopath doesn't even begin to describe what this doctor can do, this practitioner. You're beyond doctor really at this point. So I'd love to invite you briefly to kind of help the audience get situated in terms of where you've come from and how you've more or less how you've come to where you are today. And I know that you said there were three big milestones in your journey that really shaped where you are today. So fire away. The mic is yours.
Thank you. So technically, I'm not an osteopath because that's a trademark in the United States. So only American trained DOs can call themselves osteopaths. But I can, so by training, I'm an MD. So I can say legally that I'm specializing in osteopathy and osteopathy in the cranial field.
Okay.
And
right.
For example, the osteopaths trained in Canada cannot call themselves osteopaths in the United States because of the same trademark law. And just another clarification, like the only osteopaths who are physicians are the ones who are trained in the United States. There's osteopaths, there's the British School of Osteopathy, European, New Zealand, Australian. They are not physicians, but they have a diploma in osteopathy.
Okay.
And many believe that they're a lot better trained than the American DOs because of that. But speaking of my history, I was an intern in trauma surgery in Germany, and one night we were called to the emergency room for a dislocated shoulder, and there was this old Peruvian doctor who just sat down, very calm, very peaceful, just grabbed the shoulder and the hand of the patient and just started talking to him, simple, mundane stuff. And then 15 minutes later or so, the shoulder was back into place. And both the patient and myself, we were in awe. And so like, what did you just do? I mean, as an intern, I was ready to scrub and get into an open reduction internal fixation type of procedure. I was so happy, and part of me was disappointed. Like, that was it?
What? There was no screaming.
And he's not screaming. And the professor said, no, you're good. Just come back in the clinic in a few weeks. We'll check your shoulder. And if it stays there, it's going to heal on its own, and gave him all these conservative remedies. And when the patient left, I managed to bring my jaw up and talk. I said, what is this thing? Oh, this is called osteopathy. Like, wow, I want to learn that. So that was kind of my first, big dent in the belief system that I have built. And, I wanted to do surgery trauma all my life. And like the second dent was, as I was finishing my PhD in Germany in the therapy of the brain tumors, we had 6 patients who were alive 2 years after diagnosis, which for this particular diagnosis is considered complete healing. So I went to my professor and I said, Professor, look, everybody who came to our study, 183 people died following in our footsteps in what we told them to do in our algorithm, but 6 people survived. And not only did they survive 2 years, they survived 3 years. So I said, let me talk to them. I want to know what they did. And he said, oh, don't bother your young scientific brain about that, because that's considered spontaneous healing. And that's not the subject of medicine.
Do you love that?
So, because I always like to do the opposite of what authorities tell me, I call the patients, I called their physicians. The patients didn't want to talk to me because I was representing the university. But I said, look, I'm a young doctor. I'm trying to understand. Please help me. So the doctor said, okay. I called each individual doctor of these 6 patients, and they said basically they changed their life. It's a complete life reboot with whatever was available in the 90s in Germany, Ayurvedic medicine, Chinese medicine, looking at the mental, emotional, spiritual component of disease, looking at nutrition, looking at exercise. I mean, everything that was available at that time, and they turned their life around. And glioblastoma multiforme, as you know, it's one of those diagnoses that even today, it's a death sentence for most people. So that was the second big dent on top of the first one. The third one was when I was a surgical resident at UCLA. And after 6 months of not having a day off, because we were working 100 to 110 hours a week, I managed to escape one evening early and went to this naturopathic conference where this physician was, Dr. Schultz, American Botanical Pharmacy. He's pretty famous in LA since the 80s. He was putting up these health crusades in the 90s. And he had a room full of patients with all these gallbladder stones in jars or in necklaces. And I said, what is this? So, this is Dr. Schultz. We do a bowel cleanse and a liver cleanse. And, we can eliminate gallbladder stones through this gallbladder flush. And I said, what? It's like once you know the truth, you cannot unknow it unless you fall deep asleep again.
Mm-hmm.
So for me, it's like, how can I look in somebody's eyes and say, you need an elective gallbladder removal for something, and then let's say it costs $5,000 that I could pocket, versus here, $150, take these herbs and do it yourself type of thing. So then I started looking into other ways because I want to be a doctor. I want to be able to help the people, but it feels like the tools that we're using are not the best out there. And that's how I discovered osteopathy. Then I had a pretty bad ski injury where a local osteopath put me together. Literally, I was hit from behind, tumbled 3 times, and I felt like a squeezed out prune. And after, 7, 8 treatments, I was popped back up again to myself. So that's when I started looking into osteopathy, and I realized that the philosophy and the principles of osteopathy make a lot more sense because they look at the body as a whole. And there are things you can do with your hands when electricity is out. You can do it on a trail. You can do it anywhere.
Mm-hmm.
Your hands and yourself, and develop a deep sense of palpation and perception to actually understand the biological processes. Because if we don't understand the biological processes in the body, how can we guide them? And for me, I feel the biggest, it was kind of like the dark night of the soul coming from the big white horse of surgery that I'm here to save the day through that frequency band called humility.
Oh, that band. Yeah.
It's for some people, it's
Well,
very narrow.
it tends to be not highly developed in surgeons, right?
For
Typically,
sure.
as a profession, they almost need it to be relatively small to do the job that they're there to do.
Yeah, you're a god, so even a demigod is like too low on the totem pole. So it took years for me to shift my consciousness to, rather than doing things to the body, learning how to do things with the body. Because the body, it has the wisdom of creation.
Mm-hmm.
It's one fertilized egg that develops into 50 to 100 trillion cells. So all that wisdom, of form and function, is contained. The whole blueprint is in that fertilized egg. And then it just unfolds. Growth is growing and is developing. And that's one of the principles of osteopathy. Also that the growth, the forces of growth and development are one and the same with the forces of healing in the adult life.
Mm-hmm.
which is the most important sentence I would say that I never heard in medicine in school before. Healing recapitulates embryology. So the formative forces are one and the same with the forces of healing in the adult life. It's just the rate at which they work is different, because when you're growing, you have more anabolic.
Yeah.
But then when the house is built, you just do remodeling.
Mm-hmm.
Okay, a wall comes down, a bone gets broken, something happens, then these formative forces become more anabolic. So, for 6 to 8 weeks, you need to heal a bone. You're going to throw all the new construction materials at the job site and eliminate all the trash and all the debris from the injury. So osteopathy made a lot of sense to me, and it kind of helped me find my way in medicine with consciousness, with integrity, and like feeling like I'm aligning myself with a higher power
Right.
rather than me having to do things.
Love it. Can I get you to turn your phone off?
This is actually on the computer, and I don't know how to maybe turn the message. Our good friend Katrine is texting me, so
Tell her to go away. You're busy. But
I just turned
let's.
the messages off. Yeah,
Yeah, perfect.
sorry.
No, that's quite all right. Okay, so shit. Now I've lost my thread. Sorry, I wanted to get rid of the pings because then my editor would be mad at me. Okay, so from there, so you moved into osteopathy, which is really, I mean, the beauty, I mean, there's many beautiful things, but really the central tenet of osteopathy that really captured you is this idea of the body, of working with the body to help the body to heal itself.
Yeah.
Ultimately, it's reigniting that, and we don't, let's say the renovations take longer as we age. Sometimes they're not quite as strong as the original construction. I mean, the analogy is actually quite brilliant. But I think that, it's again, like a house. I mean, if you've had a leak behind the wall, there's a weakness that sets in the infrastructure that if it's not addressed, and I think this is where, conventional medicine often maybe sometimes hits the mark, is by not addressing the weaknesses that have set in the system over the years and just kind of slapping new drywall over top or a coat of paint. It looks better and it sort of works, but it doesn't work as well. And so then you always have this dysfunction. I don't want to call it dysfunction, but this altered function that is now going to change the integrity of the structure, right? Which I think with the body, which is so complex and exposed to so many different forces over the course of our lives, that just builds and builds and builds and builds from the day, from very early on in the game. But I think that one of the other things that you've talked to me a lot about in that you've integrated, and maybe osteopathy as a rule integrates as well, is this whole idea of the emotions, the whole idea of traumas and how they get represented in the physical structure of the body that alters its function as well. And so I'm going to throw out a couple of things here, and then I'm going to let you reorganize them and make sense of it, because I'm a plebe at this, so I'm doing my best to kind of set you up here. But basically, so we have the physical structure that has, blossomed into this body. It deals with physical. I mean, maybe trauma is too strong a word, but whatever. We deal with all the knocks and bumps and falls and whatever that we deal with in our life. Some of them we heal from very easily when we're young. Others maybe leave behind a little residual. But there's this whole other idea of the emotional component that can also very much impact the physical structure. And I would love to invite you to speak to the audience a little bit about that, because I think that's going to bring us to this whole other area called the fascia, where we spent a lot of time talking about this last November, and where I think you spend a lot of time teaching people and exploring, and where so much of this wisdom, like as people, we tend to think about our muscles, our bones, our nerves, and our blood vessels, but this whole other concept of fascia, which is a whole other idea. So, having thrown 27 different ideas at you, let's start with the whole idea of how the emotions affect the physical structure and go from there.
So I'm going to start with the 28th.
Okay.
So
Another one.
I have a quote here that I want to read to you that kind of was one of my guiding mottos that Paracelsus, who is considered the father of pharmacology in Western medicine, he said, "The universities do not teach all things. So a doctor must seek out old wives, gypsies, sorcerers, wandering tribes, old robbers, and such outlaws, and take lessons from them."
Okay. Number 28.
Number 28. So
The
I
school of
really,
life.
I really wanted to understand if in allopathic, in Western, what we call Western traditional medicine, if we started already compartmentalized or we actually had a holistic view of the human body. And looking in the history of medicine, Asclepius, who we consider the father of medicine, Hippocrates, who we consider the father of medicine, was an Asclepian physician.
Okay.
So Asclepian physicians were considered physician priests. They were physicians of the mind and physicians of the body. And I spoke to Edward Tick, who is a PhD. He's a psychotherapist, and he's been studying a lot this Asclepian medicine. And I asked him, why do you think Hippocrates in 400 BC separated mind, spirit, and body? And he said, I cannot tell you after studying all these decades why, but he was a product of the Greek Enlightenment that happened around. So he was a contemporary with Plato, who was a student of Socrates. And Plato is famous for decrying the state of medicine in Greece in 400 BC when he said, we have physicians for the mind and physicians for the body, although the two cannot be separated.
Mm-hmm.
So Hippocrates had been following that Asclepian model, which actually was around for about 1,500 years, of understanding how you cannot, it's like you dissect an organ from another. We cannot dissect the physical body from the mental, from the emotional, from the spirit. You know, when we look at these visionary paintings and they put these auras and the halos, they're actually deeply intertwined. And Chinese medicine always understood that, because the meridians in Chinese medicine are associated with organs, they're associated with structures, and they're associated with emotions. So when emotions flow properly, for example, let's say in the heart, you feel joy. So that's the virtue of a meridian, which is invisible to us, but to a very well-trained Taoist Chinese master, they see these meridians that actually flow in the fascia. And again, we're going to go back to the fascia, but just to give a context of what's happening in the fascia, that's where a lot of these meridians are. And then when they poke towards the surface, that's what we call an acupuncture point, because we have access to the meridian. So the fascia, in a way, is a system that penetrates, interweaves, and surrounds, holds everything. Like when you make a soup, you make a soup and then you put it in the fridge. If it has a lot of fat, that gelatin that holds the potatoes, the bones, the meat, the carrots, the turnips, that is the fascia, but it's alive in the human. So that's when I started studying all these other traditions to see what have we lost in allopathic medicine, because Hippocrates, again, he said, okay, we're going to be naturopathic physicians. We're going to address only the physical body, and we're going to relegate mind and spirit to the priesthood.
Wow. So do you think, or he was either, maybe not the first, but it was at Hippocrates' time that schism kind of happened, where people stopped thinking of them as the whole and started trying to separate them.
So we have a 2,425-year heritage of separating spirit and mind from the body, and in the West. But you have Chinese, you have Ayurvedic, you have all these native traditions that I was very honored and lucky to be part of, to understand that it's almost like the spiritual and the mundane are intertwined throughout life. It's not like, okay, I'm going to be an accountant and then Sunday I'm going to be Christian when I go to or Friday I go to the mosque, or Saturday I go to the temple.
Yeah.
No, it's all one, and their frequency bands, they're intertwining, and in a way, we really live in all these aspects of ourselves all the time.
Right. That makes sense. A lot of sense. And so, okay. So, and so this is where, so in osteopathy, in traditional osteopathic medicine, which, as you said, you're not an osteopath per se, but you're a doctor of osteopathy, or whatever
Yeah,
the
I'm
term
an
was that you
MD practicing
MD
osteopathic
practice.
medicine ever since I finished my residency.
Right. So, but in that school of osteopathy, do they teach the spiritual with the body, or is in traditional osteopathy, are they still fairly separate? Not that
Well,
it matters that much, but I'm just curious.
so not having gone through an osteopathic school in the States, I think
Right.
it's really dependent on the teacher.
And the individual. Yeah.
Yeah. So, but I taught with the Osteopathic Cranial Academy for many years, and it really depends on the comfort of the conference director, of your table trainer,
Mm-hmm.
because unfortunately the DOs are still considered like second-class citizens in the United States.
Sure.
So then they need to be better than MDs, which in many cases they are, because they learn so much more history and physical exam skills. They're amazing diagnosticians. But this is another dichotomy. Uh, we sometimes teach by the book,
Mm-hmm.
because that's more approved and acceptable, but we don't necessarily teach how we practice. But then
Right.
when you get into the intimate circles, most of my teachers have a connection to the upper management.
Mm-hmm.
Depending on what spiritual path they're on, they're going to bring the angels, the archangels, the elementals, whatever the cosmology and cosmogony of their spiritual path is.
So there's a spirituality to it. So it really varies from individual to individual. So I would say that in working with you, it was very apparent very early on that this is more than just the body, right? We talked, I mean, your intake form alone. I'm like, oh, sure, I'll just do this intake form. I'm like, oh my God, we're talking pages and pages and pages of information. And even then, there was a point where I was on the table and you're like, well, you never mentioned that. And I'm like, well, you didn't ask. And poor you had asked like 75 questions. There was the 76th. But anyway, so I think that what it suffice to say that from whatever you studied in osteopathy, you kept moving forward. Like you didn't, as you said, you've studied so many other disciplines and have now brought it, in your case, and there's probably some other people like you in the world somewhere. But your belief system has now brought together this universe of disciplines and into a practice that you practice. But at the same time, what was interesting to me is you still have this anchor in the physical medicine where you'll use something like neural therapy, like Procaine injections, to get to a certain goal. But before we go there, let's now go back to the fascia and talk about, how the fascia in many ways unites and represents and reflects a lot of these different forces in the body. Or is there something else you wanted to talk about before we kind of go there?
Um, yeah, I mean, there's Dr. Dietrich Klinghardt, who's really famous in the
Yeah, a
in
lot of
the,
people know him who listen. Yeah.
yeah, in the German biological medicine. He in the 70s he went to India and then developed this. It's like a pyramid of different levels of healing, and it's pretty amazing because that's what I found in for the natives, the Quechua speaking natives in the Sacred Valley in Cusco. Um, the Egyptians talk about the seven bodies. Like we have a physical body, a vital body, which we call the chi or prana body. We have an emotional body. We have a mental body, and then different spiritual levels: a causal, spiritual, and divine. So what I got to understand, and it's not just intellectually, but um, through palpation, through perception, and through practice, through like direct experiences, most of the time there's a downward causation. So I don't know if it's appropriate to say, but medically we would say shit rolls down the hill most of the time.
Beautiful. Very well said.
So
We can all understand that.
it's a medical spiritual term.
There we go.
So if you believe in past lifetimes, which I I'm a not just a believer, but I feel that there's truth in it. We're bringing patterns not just through the biological family that we're born with, but from our own past lifetimes. So it's not just like a physical DNA; it's a spiritual DNA, and that let's say these genetic modifications are not in the cellular DNA, but are in our field somewhere,
Your auric field. Yeah.
in the auric field. And some people call it karma, and they say it's a bad thing because you need to repay for your mistakes. And that was one of my issues early on with religion. I didn't believe in a punishing God, in a judge dread of the universe who all guilt, shame, and blame, and which are, as we know, the lowest frequencies on David Hawkinson's scale.
Mm-hmm.
And through the native teachings, I understood that this is not a courtroom. Mother Earth and our incarnations here are not a courtroom; they're a classroom. We're here to learn, to develop, to unfold, to grow our consciousness. And what many doctors like Dr. Moody and Michael Newton and all the people who study these NDEs and Eben Alexander, a famous neurosurgeon turned believer, they talk about these NDEs and they say how beautiful it is on the other side, and what you go through a life review and you get to experience all your thoughts, feelings, and actions, but through the senses of everybody else that you affected or infected. And that becomes, in a way, your life lesson, your lesson plan, and,
Mm-hmm.
and potentially your dharma, how they call it in Buddhism, for your next life. So then we have this stuff here. We have this to-do list in our spirit, in our soul, in our mental, emotional body. And if we do not deal with them there, they penetrate deeper, deeper, deeper until they become part of our physical body. And then this is a lot denser. And I like this metaphor, like you have a spring in the mountain. So when you go to the spring, sometimes somebody puts a little carved wood to direct the spring, and the spring becomes a brook, and then it becomes a bigger river and huge river by the time it, let's say like the Amazon River. And if the Amazon River down before it flows into the ocean, let's say that's the form. If you have to bring big bulldozers to move the riverbed
Mm-hmm.
to another place or to adapt it to what you think it should be.
Right.
If you go to the spring and tilt it to 1 degree, you create a whole new reality.
Mm-hmm.
And that's why it's so important, even though there's this downward causation, we need to work from soul towards matter and from matter towards soul. We need to address all these frequency bands in which we exist, which we call physical, mental, emotional, vibrational, and so forth. So, yes, osteopathy is always the foundation. And I remember 20 some years ago, I had a patient who came with a knee problem to me, and I was I was so bubbly and exuberant. I said, "Well, joints are related to flexibility, and if your knee joints are stiff, that means there's a stiffness, and knees specifically are associated with the ego." And I was going on down this rabbit hole, and I said, "Doc, I just have a pain right here in the knee. Can you fix that for me?" I said, "Oh, well, I need to get off my horse." And
There might be people in the audience saying, "Yeah, exactly. How am I gonna? What am I thinking about here? Do I have
so
to get into my auric field to fix my back? That's a lot of work."
so then we begin and so I have to see where the patient is, who is in front of me, and what their needs are.
Right.
So, which means, okay, there's a knee problem. If we look at the knee, okay, let's look at the foot, because in osteopathy, when it comes to biomechanics, shit rolls up the hill.
Mm-hmm.
If the foot, let's say this is a foot, there's a kidney 1 point here. So when we walk, we're supposed to walk like a puma. So we absorb energy through that foot and bring chi into our kidneys, into our whole meridian system, into the 8 extraordinary meridians, who are the reservoirs for the whole body. But if the foot is stiff, then this function has to be taken by the elbow, not the elbow, the knee. So
Oh,
then the knee is trying to do the work of the foot, and the knee is just a joint that goes like
it's a
flexion
simple joint.
extension.
Yeah.
So then all this rigidity starts traveling up, and it gets into the hips. And then, again, we didn't talk on live, but about the anatomy trains, how
Mm-hmm.
important it is to understand that literally everything is connected. So you can have an ankle injury, but through the fascia that covers, fascia is like a sheet. It's
Mm-hmm.
one piece of fabric, very complex, three-dimensional, and so forth. But it goes all the way to the head. You
Yeah.
can start having headaches from twisting your ankle, stepping off a sidewalk, and you go to the neurologist, to the head doctors. Oh, well, I have a pain here. Well, let's inject some Botox to kill the occipital nerve who gives me the pain. Well, why? So the thing is, in Western medicine, unfortunately, we're treating a lot of symptoms.
Mm-hmm.
It's like in the car, you have the oil gauge that shows you the oil is low. We cut the wire and keep driving. Like, we would never do that with the car, but we do it with our human body. Let's take some pain pills and
Mm-hmm.
forget about that. And I'm not saying they don't have their place,
Yeah.
but let's not forget that that's just a manifestation of something that happens usually in the opposite end of the body. So I brought some toys, since we're talking about fascia, because what osteopaths knew through palpation and perception, they were kind of vindicated by modern science. And this is a tensegrity model.
Okay, so folks, if you're listening to this, you're going to want to head over to YouTube at some point to watch this, because this is a very powerful visual. You know that whole a picture tells 1,000 words or whatever it is? This picture tells 1,000,000 words. So off you go. Go
So
ahead.
we'll start with a toy. This is just a toy. This was developed by Buckminster Fuller, who was an architect and philosopher. And then,
Is
so
that
he
a
did some.
buckyball?
Hmm?
Is that a buckyball? Is that a fullerene buckyball?
Well, I don't know if it's a Bucky ball, but it's a Bucky model.
Okay, cool. Well, I think that might be the shape of the C60 molecule. But anyways, go ahead.
It could be. It could be. So then the fascia specialist said, what if our own fascia operates like this? And what started as a working model through many studies, and a really good movie to watch is Strolling Under the Skin by Gimberto. He's a French plastic surgeon. And then Dr. Mercola came out with an article just last year about how important fascia is, and
Mm-hmm.
quoting some of the studies that were done in Italy and Sweden. And there's a fascia movie that you can find for free on YouTube, and
Really?
it's really important to look at this, at the visual, how complex this is. And If I'm not mistaken, I think fascia was declared an organ in 2018. So
Wow.
basically, it was acknowledged, and they even found these cells. I mean, they named them, this Italian anatomist and professor of orthopedics, fasciacytes. So the cells of the fascia, and it's almost
Oh.
like we are, instead of being organ centric or muscle centric or tendon centric, she said we need to kind of reorganize our thinking. We need to be fascia centric, because everything happens in the fascia, and the fascia is the one that's responsible for health. And if the conditions are not proper, they create the premises for disease.
Mm-hmm. Mm-hmm.
Which in part of my studies, now there was this Dr. Alexis Carrel, who in 1912 discovered that the pulsation of life can go forever. So he had these chicken cells in petri dishes, and he was able to extend the life of the cells way beyond the life of a chicken by just giving them proper food, eliminating the exhaust, and then when the colonies would grow too big, put them in another petri dish. So in my mind, I said, okay, there's only three causes of disease in the physical. There's inadequate nutrition, accumulation of toxicity,
Mm-hmm.
and trauma. Now,
Mm-hmm.
in those petri dishes, trauma would be like there was too much squeezing, so they couldn't basically grow. So there was a mechanical factor that was reducing the growth.
Right.
So literally in the physical, there's only three causes of disease. And yeah, you can go down the rabbit hole of nutrition, toxicity, how we're bombarded from all directions these days, and so forth. But then there is this trauma. So what they concluded is that these are the elements of compression. So the hard stuff, the bones, are the elements of compression, and the soft tissue are the elements of tension. So proper balance, proper health from a mechanical perspective in the fascia is that there's checks and balances between the elements of compression and tension.
Mm-hmm.
So let's say you get a hit, you're a baby or you're a toddler, when somebody, it's almost like they bump off the ground when they fall. That's how much elasticity and fluidity and lubrication is in the system.
Right.
So they might not have a long-term trauma. The body might be able to deal with these forces. And this is the third law of Newtonian physics, the principle of action and reaction.
Right.
There's action and reaction are equal. Now, let's say if you're already toxic, you have not proper nutrition, you're dehydrated, you're not proper rested, you're stressed, which affects, and we'll talk about that too. The fascia is affected. So let's say the fascia is here, and then you have a trauma.
Yeah.
That's an added insult to the existing injury,
Yeah.
because these fascia cells are secreting hyaluronic acid, which is it's a GAG, glucosaminoglycans.
Mm-hmm.
They bind the water, and what they say, we have these, get into the phases of water, but basically there's two phases at the cellular level. There's the gel and the sol form. So the gel is the gelatinous, and the sol is the fluid. So when the fascia can stay fluid like that, everything works well. But when we have trauma or accumulation of toxicity or inadequate nutrition, that solution, from being a lubricant, a fluidifier, if you want, becomes like a glue.
Mm-hmm. So for the fascia, are you saying, is part of the new, I mean, it's amazing that 2018 was like 10 minutes ago. Like, it's, talk about late to the party. but in what we know, does fascia require different strategies for proper nutrition, hydration, removal of toxins, like in and of itself, or is it entirely reliant on the rest of the body to provide it with the hydration, the nutrition, the removal of toxins? Because does it tie into the lymphatic system, for example, which is another system that doesn't get quite as much attention as it probably should? Because again, it's like, we tend to be very simple-minded in how we see the body. We see what we see, and that's what we care about, right? That's part of the reason why the whole spiritual thing goes out the window, because we don't see it. And the fascia doesn't get a lot of attention because people worry about, oh, do I have muscles? Do I look like I'm fit in shape? Not realizing that the fascia has everything to do with those optics as well, or at least how those muscles work. But does the fascia need its own care system? I guess is what I'm kind of asking.
Well, I think the first thing that we need to do is we need to completely restructure our thinking on how the body operates and understanding that we really need to become fascia centric.
Yeah.
So where our attention and intention go, energy flows.
Yes.
So where chi flows, blood flows. So it's that downward causation. So if we start asking the proper question and trying to understand, we realize that there is a plethora of modalities out there that we need to unify. And when we understand that no specialty, no technique has all the answers, they're like branches on the tree. Let's look at the whole tree and understand how the tree works as a whole.
Right.
So it's just a matter of completely shifting the perspective. And then, like this, she's a surgeon, she's a professor of anatomy. When you look at this Fascia movie and the other people who are interviewed, it's like, oh, we didn't think of it, because again, we have this heritage of this Cartesian thinking that everything has to be dissected and cut into parts, and thinking that if we understand the parts, the whole is the sum of it. But it's not.
No.
It's way beyond.
Yeah.
So when we talk about the fascia, we need to talk about this extracellular matrix. Extracellular matrix, in the old days, they used to call it like the third space. So the cells live in this fluid. Outside of the cell is this extracellular matrix, basically where I call it the marketplace, because you have nerves ending in there. You have all the afferent nerves, that the ones that take information from the cells, from the periphery to the upper management, to the local, regional, central ganglia, to the CEO.
Yeah.
We have that's where the capillaries end. So they bring the arterial blood, which is not just oxygen, but it's an electromagnetic charge, and there's a photon in every red blood cells. That's what they discharge in this extracellular matrix. And then that capillary becomes a venule, so a small vein, and then the blood that's devoid of what it just shed there, oxygen, electromagnetic charge, and light, goes back to the heart with the information of what that particular cell needs.
Interesting. So it's not coming back just with garbage. It's coming back with garbage and a message.
The lymphatics are the ones that are the sewer, which in surgery, like, who cares? When I was training in surgery in the 80s and 90s, we didn't care about the veins either that much. But so then you have the lymphatics that pull all the stuff and then refine it and clear it through the lymphatic nodes before it gets back so it goes here back into the subclavian veins.
Yeah.
Which is very interesting, like in osteopathy, understanding that if somebody has tight clavicles, this connection, the whole, like a frozen shoulder, first rib, issues with mobility, they cannot properly drain the lymphatics. If we don't exercise, that's what moves venous and lymphatic drainage, is this movement in the fascia. It's hydration, but it's movement. You need that muscle pump to bring it back up. So this is what's happening in this extracellular matrix. The nutrients go in the cell. The cell, it's think of like those medieval castles when the flap goes open, the villagers, let's say the paisanos, bring the food and
Yeah.
everything that they grow outside of the city, the the city, how do they call
The
them,
city walls.
the
They come,
city
yeah.
walls, and then they take the trash out.
Yeah.
So that's how the cell operates too. And then I brought another toy
Ooh,
which
that
the
toy's
kids
big.
like. So let's say this is a normal cell, and these are the gates through which stuff comes in and out. A cell, when it's at ease, it's here. Cells inhale, exhale. So there's inhalation and exhalation. Now, when there is trauma, the cell are in what we call a sympathetic state, where they
They
can like
collapse.
barely
Yeah.
breathe. It's like you wearing a t-shirt that's 4 sizes smaller.
Mm-hmm.
You feel so constricted, and that's what a sympathetic state does to the cells. And Bruce Lipton was the first one to say that one cell cannot live in both modes at the same time.
Yeah.
It cannot live in a sympathetic and parasympathetic at the same time. So sympathetic, um, your audience, I'm pretty sure they're familiar with Stephen Porges's polyvagal model.
Yeah.
We have all these different levels of adaptation. The first one being the left vagus. But if we're not able to deal socially with what we perceive as a trauma, we go into a sympathetic mode, and then there's different levels of the sympathetic. Fight. We try to fight. If we're not able to fight, then we get the hell out of Dodge. That's the flight. Then there is the lower level of adaptation is freeze,
Mm-hmm.
fawn, and faint. And then underneath that at the bottom is the right vagus. And if these levels of adaptation are not enabling us to deal with the trauma, that gets stuck in there. And that's where, like you talked about neural therapy, that's where neural therapy comes in, because let's say, we have the autonomic nervous system, the involuntary, that has all, the sympathetic, parasympathetic component. We have all these ganglias. Just to give you an example, I had a patient that 20 years ago had a C-section, and she was forced by the hospital, by the physician, to go into it. And she said, I didn't really appreciate it. I had to do therapy for years, but I'm fine with it now. I said, okay. So we worked physically, because again, there was this compression in the system, in the pelvis. And this is actually the truth integrity model of a pelvis. So we first worked, let's say, macroscopically with vibration and with manipulations to help that state come to from where it was here to here.
Mm-hmm.
But there was
Get it
still
basically to get moving again, right? So the
to
pelvis,
to
just to,
restore.
just to put that a little bit into words, the pelvis basically took the brunt of the trauma shock of the
Yeah,
C-section, and kind of it got left kind of in this contracted state. Would that
exactly.
be accurate?
That's perfect. And
Yeah,
contracted,
and
uh,
stuck a little bit.
also keeping in mind it's a complex three-dimensional matrix.
Yeah.
So you can't say that, because each vector of force and how we perceive and interpret something, that's why it's such an individual thing. For
Mm-hmm.
people, they brush it off, and like there's no mental, emotional energies attached, associated with an event. It's like they brush it off. And for some people, it has such a big impact, like it had for her. So physically, with the hands and with vibration, we were able to help restore the macroscopic function, so to say, the proper movement of the pelvic diaphragm and the SI joints and so forth. But there was still something. It's like it's not fully back where I know the health would be. So then we said, well, we need to do a few things. Let's inject that C-section scar with Procaine.
Okay.
And then,
So can I stop you for a second? Can you
yes,
explain to the audience what Procaine is and why you would do that? So just to situate us, Guy, we have a pelvis that's kind of, was subjected to this C-section to birth the baby, but it got left locked up and basically altered. So, through vibration, kind of get things to start to open up a little bit and loosen up. And now there's a C-section, and maybe explain how the C-section is playing a role here, that scar. But first, let's talk a little bit about what is Procaine, and this is where we're getting into the neural therapy piece.
So it's a funny story about Procaine. It goes back to Professor Ziggy Freud.
Oh my God.
Well, Ziggy was Zygmunt was
Ziggy.
experimenting with cocaine in the late 1800s, and apparently most of his writings and insights came from cocaine.
Cocaine, not Procaine. Yes.
Cocaine.
Yes.
And they had these intellectual group in Vienna where they would meet with scholars in different fields. And one day he tells one of his best friends, who was a ophthalmologist, "Man, you guys are doing all these procedures with no anesthesia. Why don't you try cocaine? It's amazing for anesthesia. It has a small side effect. You become addicted to it." But so they started using cocaine in surgeries, and obviously the undesirable side effects of cocaine were there. And then this this biochemist, this German guy in 1905, took the cocaine molecule and was able to separate all the addictive aspects of the molecule, and he created Procaine, which they're cousins.
Yeah.
But I call it the most natural synthetic out there, because somehow each cell in the body has an enzyme to break it down. And compared to all the other canes, lidocaines and so forth, that have to go through the liver. And also Procaine has a vasodilatation effect, which is pretty amazing, and anti-aging and anti-carcinogenic. There's a lot of studies over the last 100 years on it. So then the Hünecke brothers, these German brothers, by accident, one of the brothers was leaving for a cruise and told the other brother, "Look, there's a patient that has migraines. I'm going to leave you this Procaine and then this other vial of what I was injecting in her, and make sure you inject this one, not the Procaine." And sure enough, the patient comes and his brother forgets and injects Procaine IV instead of the remedy that he had been injecting. And all of a sudden the migraines completely go away. And
Like
that's how the whole
completely.
And that's how the field of neural therapy started. And they started trying to understand what it actually does. And what we're seeking in neural therapy is to look for interference fields.
Mm-hmm.
We think that what moves biochemistry is biochemistry, but it's not. It's voltage. And that's where this vital chi prana body comes in. And that's why the autonomic nervous system is kind of the interface between the physical body and the upper bodies, the less denser, the emotional, the mental, the spiritual body. So Dr. Tennant, he did a lot of studies to show how important voltage is.
Mm-hmm.
And more recently, Dr. Fulford, an osteopath, he passed away 20 some years ago, but he concluded that when we have trauma in the body, the voltage changes. So instead of having those minus 80 millivolts on the outer membrane, it actually reverses. It becomes positive.
This is a problem.
So that's a big issue. So then how do we help the body to reverse this voltage? Because in order for each cell to maintain all its functions, it needs that difference in charge.
Yeah, the
between
polarity. Between the outside and the inside. Yeah.
And many people say that the cancer cells usually have such a low voltage that all they do is replicate, and there's no other self-modulating, self-regulating, self-healing mechanisms in place, because biologically kind of the prime directive is go out there and multiply.
Mm-hmm.
So neural therapy addresses these interference fields, because not only is the function of the cell impaired, but it sends these abnormal impulses to this chain of command. And finally in the West, we figure out that that's what actually PTSD is. It's it's in a way it manifests like that. There's a loop that runs in the back of the computer,
Mm-hmm.
constantly using your RAM. And even though the external stimuli is gone,
It's
that
stuck.
loop still, it's kind of like Groundhog Day.
Yeah.
And that's how Rambo still thinks he's in Vietnam. And
Right.
this is how they explain also the phantom limb pain.
Mm-hmm.
The matter is gone. So let's say the source of the pain is gone, but the impulse is still there because it's stuck in these ganglias, in the local, regional, or central ganglias. And by a simple injection of procaine, we actually restore the polarity, the voltage of the ganglia. And that's when the amazingness of letting go of everything that was stuck in there, not just voltage, but the mind and the emotions. And going back to our patient,
Yeah. This is.
we injected. So she was totally cool. I'm injecting the scar, which is pretty big, which again also because it cuts through the midline. There's a lot of embryological channels that are being disrupted by this deep, deep cut. So we're injecting, and I'm getting to the last inch, and she starts wailing out of nowhere. And for 5 minutes, she's wailing, uh, saying how she's been disrespected and she felt violated 20 years ago because when they forced her to do something against her will, and it was not even medically necessary, but the doctor was leaving on vacation the next day and they wanted to do it. Well, years of working at the mental emotional level helped her cope with it there, but there still was all this energy that was stuck in the tissue, let's say in this extracellular matrix,
Mm-hmm.
in the fascia. And then when the procaine went there, it's almost like it opened the floodgates of whatever emotion was stuck in there to be released. And she was completely fine. She wailed for 5 minutes, and then it's like after summer torrential rain, the
Yeah.
sun came out and everything was fine. But that part was the missing link there.
Interesting.
And that's the beauty of Procaine, because it helps us get to these places that nothing else, unless you go to a shaman,
Mm-hmm.
I found that can help with these things that are literally stuck in the tissue, in that sympathetic clamp.
Yeah. So, I mean, it's a fascinating concept, right? Because she thought she'd figured it out. She thought she'd worked it out. She was like, her conscious mind was like, I'm good. Like I understand it.
Absolutely.
It is what it is. Let it go, move past it, whatever her therapist. And yet it's this whole back to that book, The Body Keeps the Score, the biology, this whole body, like more modern body of a lot of the history that you're talking about, where things are trapped at a physical level that are emotional. And so the Procaine, what's also interesting about the Procaine, just to explain to people who are not familiar with it at all, it's a 20-minute effect. It's gone with it. The body's metabolized it and gotten rid of it after it's 20 minutes, right?
20 to 30 minutes, but
Depending.
not, yeah. So
And,
let's say we start on the hour at 12. Whatever we injected at 12 goes away by 12:20, but we keep going.
mm-hmm.
And so the see, one of the things in allopathic medicine that we always think more is better. So they've been using this famous the $3,000 stellate ganglia block, and we're using anesthetics that have a half lifetime that it's a lot longer. And I actually had patients who had terrible experiences when something else than Procaine or lidocaine. Lidocaine is an hour and 20 or so. Something that the half life was 7 hours. So they
Wow.
were in terror. And it goes back to the neurotherapy teachings: is we don't have to block a ganglia for 7 hours. It goes back to, I don't need to do something to the body. All I need to do is I need to help break this Groundhog Day wheel, and the body in its wisdom will reset itself. And that's where most of the people who don't have access to Procaine will use lidocaine, but Procaine is the one that I like the most, because 20 minutes is gone, and all we need to do is we just need to reset it. And then the autonomic nervous system, in its wisdom, sometimes we inject the lower ganglia and an upper ganglia resets because that's what it needed.
Yeah.
It's way beyond the speed of light. Things are, oh, I was stuck in this. I thought, no, boom.
Yeah. It's a reset. It's a systemic reset. And it's interesting because it's almost like the kind of work a chiropractor might try to do at a mechanistic level, like at a, this rib is out of place, or whatever the case may be. But the underlying pattern of the tissue or the nervous system never really gets shifted, which is why,
Exactly.
A week or a day or 2 weeks or whatever, it's come back. And then and it's like this crazy back and forth and back. And it's like this, this crazy tug of war where the body won't let go. And yet with the prolotherapy, or the Procaine, sorry, the neurotherapy. Yeah. With the neurotherapy, you've interrupted the pattern at a much deeper level so that you don't actually have to move the bone. You're not moving the harder tissue yourself. The body's doing it itself, or it's allowing it to come back into place. Is that a bit accurate-ish?
It is. And one of my teachers would say that if you have to use more, it's hard to do it on the screen, but in chiropractic, usually what we call, in osteopathy, we call it high velocity, low amplitude. So you have to use a very precise amount of force with a small amplitude to affect the change. And he said, if you have to use more force than just a tiny push on it, you haven't done your work to remove the trauma exactly from what you said, the soft tissue.
Yeah, that was holding
it
there.
We really need to treat the whole. We need to understand that everything is interrelated and interconnected, and there's no one way that can cover it all. So that's why you need to work at the fascia level, you need to work at the fluid level, you need to work with the nerves, you need to work with vibration, because all these things are synergistic to help this fascia be able to breathe again.
Mm-hmm.
And then in a way, this last, at least how I feel it, this last missing piece is the Procaine, to actually take the autonomic nervous system out of the sympathetic mode, to bring it into a neutral, because the opposite is the parasympathetic, which is rest, digest, detoxify, heal, and feel. And a healthy autonomic nervous system, Dr. Klinghardt calls it open regulation, meaning that it's free to move from a sympathetic. Sympathetic is not bad. It saves our life. It's a parasympathetic. But what happens is we get stuck mostly in a sympathetic state, and that's not healthy because our cells cannot operate in that mode.
And so do you see in your practice, because you see a lot of people for a lot of different reasons, I kind of want to close the loop for people a little bit, because I think that the thing that we haven't necessarily articulated directly yet, but I think remains the nut of this, is that a lot of what people think are a physical problem, like not even like with a bone or muscle, but even like an organ issue, like digestive issues or any kind of other, we could call them even medical issues. A lot of times people are really struggle to fix those issues. But there's this other piece that you've been talking about now for the past hour, that if you could bring that piece in to the healing, to the cocktail, you would either get a resolution that you can't get otherwise, or you would get a much faster, easier resolution. Like that's my question. I'm going to stop talking.
No, that's very valid. And we have to go back to Chinese medicine or Ayurvedic medicine, because they really understood, like, let's say, for example, the liver gallbladder meridian. If the energy flows properly through the liver and gallbladder meridian, the energy that emanates, so say, from it's loving kindness and compassion. But if the energy in that meridian start being interrupted or being it's like, think of a tube, like a hose. It's kinked.
Mm-hmm.
Then that frequency shifts to anger and frustration, and it goes both ways.
Right.
Now, how many times we you say, oh, you have anger issues from the liver, and people who drink a lot of alcohol, it develops into a rage because the liver gets too hot. Or how many people talk about the lungs associated with the grief?
Yeah.
You don't have to be an expert in Chinese medicine, but that's what it is in Chinese medicine. It's the lung and the large intestine, and if there is grief there, then the physical organ cannot fully heal because there's this overlay of an energy that's constricting it. And as we know, energy in motion is an emotion. So
Mm-hmm.
that's why there's all these different ways of helping you to purge these emotions. There's so many different systems out there besides going to an acupuncturist, but it's how do we access the imbalance in the emotion, and then we find it, okay, it's correlated to an organ and a system. Like when we work with ligaments and tendons, that's part of the wood element, that's part of the liver gallbladder, for example.
Mm-hmm.
When we work with kidneys, that's bones also. It's kidney bladder, but it's bones. So the fear is the detrimental energy that flows through that channel. If it's a healthy energy, it's the gentleness, but that's affecting the bones. Then the bones become brittle, and you say you have osteoporosis. Well, that's an effect of an effect.
Interesting.
But if we start working at going back to that spring, okay, what emotions do I harbor?
Mm-hmm.
And you talked a little bit about trauma, but that trauma can start in utero. Sometimes you have to say, okay, how was your mother's pregnancy with you? Were there
Mm-hmm.
any emotional issues? Because before age 7, literally, we absorb everything as is. We don't have a conscious mind yet. So all that becomes an operating system inside of ourselves, besides whatever imprints we bring from the past. So yeah, I was mostly depressed. I was feeling all these different emotions. Well, let's see where that comes from,
Mm-hmm.
and try to deal with it there, and see that if we're changing a dissonant energy into a harmonious or resonant energy, that's working with that downward causation. So we work from the emotional, from the upper to the lower, and from the lower to the upper.
Yeah. Well, and so you would see, it's funny, I almost don't want to say that you're going to see like a resolution of physical ailments, but to some degree, even if all you're doing is restoring the ability to the organ to function properly and freely, you might not get as many, let's say, respiratory issues. Or if your liver is working better, you're going to see that reflected in your blood work. Like there's an actual physical manifestation of having done this work that will show up in addition to doing all the other things we know that we have to do, right? Like, I mean, it's
Yeah.
not, I want to, you know, the people that are listening, I don't want you to get lost in the ephemeral aspect of this. I just want to make sure that we understand that there's such a clear connection between the physical function and this whole other energetic spiritual piece that sounds kind of woo, but if you really allow yourself to think about it and be open to it, you'll know it makes so much sense. And it's a big piece of, like, when you were talking about at the very beginning of your career, like those 6 patients who spontaneously healed, that your allopathic teacher said, yeah, we don't deal with that. There's a whole book called Spontaneous Remission, I think it's called. And, sadly, the allopathic model doesn't allow, it kind of says, yeah, those are outliers. That's not what we're dealing with. Whereas actually they're kind of missing the point. That is what we want to be dealing with. And what you said that these people did when you talked to their doctors, they changed their lives. They addressed maybe their stressors and strains and
Everything at
every
every
little
level,
piece
mentally, emotionally, physically,
physically.
spiritually. Yeah.
Yeah. Yeah. And so to circle back to that piece, and for us all to understand, even today when we're stuck in, because I see, I talk to so many people who've been dealing with, call it Lyme or mass MCAS, like mast cell activation syndrome, or now this other one, SIRS, like chronic inflammatory response syndrome, or cell danger response. Like this cell danger response, as I've been listening to you talking about it today, of course there has to be an energetic piece to it because the physical doesn't explain it. Like so often these people they've done all the things. They've gotten rid of the histamines. They've taken the antifungals or antiparasitics or whatever it is, and they're still stuck in these states.
So the science has a very nice name for this. It's psychoneuroendocrine immune system. That's
Yeah.
how they describe the human being. And it's
Mm-hmm.
again back to that downward causation. So if you don't feel safe, sometimes people don't have boundaries because we're open, we're receivers and emitters of energy, right?
Yeah.
So how many times you go in a room and let's say you're a beautiful woman, or not just let's say you are a beautiful woman, and you go in the room and you attract all these energies, you feel something penetrating your field, right? Like somebody's having this gaze on you, like, whoa. Or you sit next rubbing elbows with a Debbie Downer. That
Mm-hmm.
low frequency eventually is going to come into your body because we're open energy systems.
Yeah.
That's what we need to understand. We're not like, oh, we have such a good shell around us that nothing comes to us. That's how 5G affects us. That's how, all
Yeah.
these frequencies, that there's that amazing Furstenberg's book, the Rainbow, I forgot.
The rainbow effect. Is
No,
it?
no, no. I was just looking at, give me a second. Let me find it. The Invisible Rainbow.
Right. I've heard of this book.
Yeah.
Yeah.
It's like a textbook to explain that he goes to the history of humanity, and what we thought were these plagues were changes in the electromagnetic fields of the earth, and some biological beings didn't adapt to it and then died and had all these different symptoms. So we are these open energy systems, and it's so important to like separate, are these even my thoughts, are these even my emotions? And I've seen with people who have such an increased permeability in their field that everything from the outside becomes a potential stressor or
Mm-hmm.
enemy. And
Yeah.
then the immune system hyperreacts. Let's say instead of sending, so there's an inflammation somewhere, instead of sending one ambulance, it sends 1,000 ambulances.
Yeah.
Not because of the chemistry of what just happened, but because they're in such a high sympathetic state that they completely overreact to something that could be taken care of with a band-aid, and it's completely blown out of the proportion. So there is that component to all these reactions. So I feel that if people can look at the traumas of their lives, and it's almost like agreements, let's say
Mm-hmm.
you're a 3-year-old and something happens, the perception and interpretation of a 3-year-old determines function and behavior. And then here you are 52, and part of your soul operates based on an agreement that the 3-year-old made.
Yeah. No, for sure.
So then there's all these different types of bodies of work, of people who can help you get to that 3-year-old and help change an agreement,
Mm-hmm.
because it's almost like a part of you it's still stuck at that evolutionary age. And then when anything similar to whatever threat and agreement was made happened and was made at that time happens when you're 52, the same loop will be brought up, and it's going to manifest as something. For some people it's going to manifest as as autoimmune. For other people, it's going to manifest somehow or somewhere else in the body.
Yeah. Well, it's part of your operating system, right?
Exactly.
It becomes part of your operating system. Okay. So where do people find people who do what you do, or some of what you do, or have been to this much broader school? And it never ceases to amaze me how every time I meet a practitioner or a healer or someone in the space, like the number of people who are tapping into the space of the Ayurvedic, the traditional Chinese medicine, the native medicines, like these much older practices that, they figured this out a long time ago, that you can't separate the whole into little bits and think that you're really going to get the end result, which is not. And the one thing I want to say is, it's not to say that allopathic medicine has nothing to offer, because there are times when you need a bone to be set. There's times when you do need an antibiotic. Like, don't kid yourself. Like, there's time
Absolutely.
when a tumor needs to be removed so that those systems can be re-engaged and the body can resume healing itself. Like, there's, I think too often people go black and white on this stuff, and you cannot, again, just like I think medicine is a universe, or the practice of healing, like however we want to call it, is a universe of practices. And where allopathic medicine sometimes has gone wrong is to lock out the other guys. So I think in a perfect world, we access all of them and as needed.
You're so right, because an example that came to mind was, I had this patient who I sent to a naturopath because she had gallbladder stones, and I said, work with him and make sure you get an ultrasound first, and
Oh yeah.
then then go that route, because she didn't want to have surgery, and she was not in an acute situation. And obviously, Western medicine is amazing for anything that's acute. Emergency department, emergency medicine can save somebody's life. So for whatever reason, the naturopath didn't do the ultrasound, and this lady was suffering a lot. And after literally a year of doing all these bowel cleanses and liver gallbladder flushes, nothing happened, and she was in terrible pain. And then she came back to me and said, well, let's have an ultrasound since you didn't do it. She had a 4 centimeter stone. Now, a
Not
four
going to move.
centimeter stone ain't going to move.
Nope. You got to leave it alone and make friends with it.
Yeah. But then she was concerned, because she was working in the movie industry, going on sets all over the world, and it was bothering her for that long. And she chose to have a gallbladder resection, and she was so much happier, and all the discomfort was gone. So exactly, we have to bring all these different aspects of medicine together, and realize that as practitioners, we're not the captain of the team. We're consultants. It's the patient. It's all about empowering the patient to be the captain, to assume the responsibility of their life, which one of the things that kind of Western medicine has done is to take that power away and say, we'll fix you, don't worry about it. Whereas holistic practitioners, a true holistic practitioner is the one to empower you to assume responsibility of their life, and realize that we're co-creators, we're coaches, we're helping, but the patient has to do their part.
100%.
So
100%.
that's the beauty of changing the consciousness. Holistic doctors changing their consciousness and realizing that, like in the jungle, since we were talking about indigenous ways, like they talk about ayahuasca does 50%. You still have to do your 50%. Whatever teachings you get, whatever healings you get in a medicine ceremony, you have to do your 50%, because otherwise it's not going to work.
Yeah. Otherwise, it's just a trip.
Exactly. And then it's like you go to the priest on Saturday, says, Father, I have sinned. Okay, here, do 10 Hail Marys, and
Off you
then
go.
you keep doing the same thing next week, and then come back and get the same prescription. As far as practitioners, again, in Canada, I'm not familiar with.
Or the US.
Well,
Is
in the
there is
U.S.,
there like a central body? Is there a website people can go to? Like, are there
so there is.
or are there keywords that people should enter into the search bar? Like, what would be your
Well,
advice on that?
so for me, And having worked with Katrine here, it's been such a blessing because she's literally the smartest naturopath that I ever met. That
I'll second that. Yep.
I mean, the way her mind works, the connections that she has, the people, the wizards in their respected fields that she has connected with, the quality of the supplements and the products that she's using, and the technology
Mm-hmm.
speaks, volumes. Because when I was in LA, so there's this thing of, let's create the mill, let's create the algorithm, the template, and I don't have to think.
So I can scale. Yes.
That's a heritage of the Western model, where we're trying to do evidence-based medicine and do the golden standard of care. The only golden standard of care is look who's in front of you and see what they need and what is the priority of healing. And don't throw 10 different things at them, because the body's going to get overwhelmed. You
Mm-hmm.
cannot open all these different job sites at the same time. And that's the for example, the beauty of working with Katrine here locally, that she has besides the fact that she's so smart, she's very intuitive, and she has
Mm-hmm.
ways of testing, because that's the most important thing: is, do you have a way to test what the priority of healing is? Because if you do too many things, Dr. Klinghardt will call it closed regulation. You shut down,
Yeah.
and then you can take the best NAD, the best ozone, the best Myers and cocktails in the world. Your body's going to be in that sympathetic state.
Yeah.
So since you don't have Katrine in all the towns, since she didn't figure out the way how to
Clone
clone
herself.
herself, I would look on Dr. Klinghardt's website.
Nice.
So
Yeah.
Dr. Klinghardt has a different websites, and there are people who've been doing this for a long time. And through their ART, it's an autonomic response technique. And then use your intuition and see, do you feel, because the most important thing is to trust and have this resonance with the practitioner.
Mm-hmm.
So I so when it comes to working with metabolic aspect of our physicalness or physicality, I would work with like an ART practitioner, who's a holistic physician, because they can see how, let's say you have Lyme, what's the entryway.
Mm-hmm. What's the order of operations is what you're talking about,
Exactly.
right?
The
There's
order
an
of
order.
operations, and then remove some of these layers.
Yeah.
As far as osteopathy, there's the Osteopathic Cranial Academy, who has a website. It's the Osteopathic Cranial Academy.
Yeah. And you
And then
teach for them sometimes, right?
I got pretty busy the last, probably, I haven't taught in about 8 years with them. And there I would look for people who've been doing it for a long time, because it says practicing graduated then, and that the percentage of how much osteopathy they do.
Okay.
That's for United States. For Canada, I know there's a lot of good people and a lot of good schools. And in my experience, the best thing that works is word of mouth.
Mm-hmm. Yeah.
I've been to
Referrals.
them, the referrals, and that's how it worked for me over the years. When it comes to neural therapy, there's the North American Academy of Neural Therapy, naant.org. And so they have Canadian and North American members. And there's no certifying board um, to say, okay, you're certified by, they're
Yeah.
working on it. It's a newer organization, but you can look if they're founding members. You can reach out to see, are they doing any deeper ganglia injections.
Mm-hmm. Yeah.
And that's
Definitely.
that's a
Yeah.
very justified question to ask even the front office. Are they just injecting the stellate? Well, it's good, but if you don't inject the superior cervical or the vagus or the celiac or the lumbars or the hypogastrics, I mean, um, it's not complete, but it's an amazing start.
Yeah. For sure. Yeah. And I'll say on the neural therapy, you definitely want to find someone who has some experience in the area because I mean, having done it with you, which was not something I thought I was going to do. I think we had this conversation when I first walked into your office. I may have had my arms crossed.
Yeah, I'm good. I'm fine.
I'm not doing that. I'm fine. Next thing you know, you're sinking a needle into my neck. And I'm thinking, holy jumping, how am I trusting this guy to do this? I think it comes back to what you said earlier, a few minutes ago, which is number one, you want to find a practitioner if you can that people have gone to who have experience, but your human Wi-Fi will tell you when you walk in the room. Your human
Absolutely.
Wi-Fi, 100%. And it doesn't mean that the other person's no good. It's a question of, are you compatible? Because in the way that you said, as a healer, we are your partner, we're walking with you, we're guiding, there has to be some synergy of energy between the two people so that there's trust and an ability to work together. So I wouldn't say that walking into a medical or a healer's office and not feeling comfortable is a bad reflection on them. It may just be that this isn't the right person for you right now.
Exactly. Exactly.
So, okay. What would you like to give people as contact information for you if they'd like to learn more about your work? I know Katrine's very worried about this. So fortunately, Sedona is not an easy place to get to.
Well, on my website is Dr. Tudor. So DOCTORTUDOR.com.
We'll put it in the show notes. You don't have to spell things.
And it really explains more about osteopathy, neural therapy, prolotherapy, which we didn't talk about.
Yeah.
For example, for prolotherapy referrals, you can look at the AOA PRM, which is an osteopathic association for prolotherapy and regenerative medicine. There's a lot of practitioners there, and it tells you what they do. Mm-hmm. Some do osteopathy. I mean, for me, the ideal combination, just because of my own experience, is osteopathy, prolotherapy, neurotherapy. And with these three things, we can correct a lot of the structural things, and then, let's say, the naturopathic metabolic part comes in, and this is like the ideal marriage.
Yeah. Thank you.
Sure.
And of course, I'm not sure when this podcast comes out, but if it comes out before the last week of March, that'll be the next time that I'm bringing a group of people to Sedona. And as part of our retreat, if you're lucky, you'll get some time with Dr. Tudor.
No, we'll organize it. The way we're doing it is the week that the retreat is happening. I'm not scheduling any other patient, just exclusively from
just for us,
just for the group, to make sure, because I want to be able to get two to three treatments in. I know it's a lot.
It's worth it.
It's worth it. So we can clean the foundation. We can do some restructuring. So then all the beautiful work that Katrine does can stick, and you can go home with something that keeps working for the months to come. And we're always, when patients come here, we're always, finding out first where they're coming from. And sometimes if there is good referrals for osteopathy or neurotherapy in their area, we suggest to start the work there, or at least continue it after, because it has to be a continuity.
100%.
Yeah.
All right. Otherwise, you just keep coming out on retreats with me, and we do it that way too. All right. Dr. Tudor, thank you so much for your time. Thank you for all that you've brought, all of your wisdom that you've brought us here. And I would look forward to seeing you in March.
Thank you. Thank you so much for having me.
It was a pleasure.
It's a pleasure for me to talk about these things. And I really feel I want to talk more about it because it's so important. And physicians have to be educators. That's what a doctor is a teacher. So this is what shamans were in the old days. They were teaching from a book of nature, interpreting the book of nature and kind of simplifying it for the people who didn't have the abilities or the qualities needed to understand. And we're not the head of the team. We're coaches. We're just walking together on this beautiful journey on Mother Earth.
Thank you.
Thank you.